As we move into the festival season, we can expect a spike in the number of COVID cases. Unexpectedly, you will have your doubts if you should get tested for COVID 19. I have gone through quite a few protocols laid down by various governments of when you should get tested for COVID 19, and the recommendations seem to differ from country to country by a bit. So I have summarized the data and I'm going to give you in simple terms in my own personal recommendations of when you should get tested for COVID-19. I am also going to tell you which tests you should be doing. Do get yourself tested on the following criteria. If you are vaccinated or unvaccinated and are showing COVID-like symptoms, that of upper respiratory tract infection, lower respiratory tract infection, unexplained diarrhea or sore eyes. I have noticed vaccinated people often complain of things like joint pains, body ache, and fatigue when they have COVID with no respiratory tract involvement. On further tests, I have found them having systemic inflammation and elevated D dimers. If you are unvaccinated and have come in contact with a confirmed COVID case for longer than 15 minutes indoors, do the test within the first 4 days, even if you do not show any symptoms. If vaccinated, do your tests if you show even mild non-specific symptoms within the first 14 days of exposure to the confirmed contact. The same protocol as the one above applies if you have attended a large social or mass gathering of people for both unvaccinated and vaccinated groups. If you are traveling by air, your respective government will have the mandates already chalked out. But I would advise people who have traveled by air to do their tests anyways 4 days after the date of travel, since air travel puts you at a higher risk of getting COVID due to the larger crowds and confinements of space. If you have already tested negative and are still showing symptoms of COVID, you might have to repeat your tests after a gap of 2 days. If you are suspecting COVID or are showing flu-like symptoms, do isolate and wear a mask so as to avoid transmission. There is also a lot of common cold in the air as well, but it is better to be safe than sorry. Your period of isolation is 10 days from the first symptom of your disease. In case you are asymptomatic, your first day of isolation is the date you tested positive. If you notice, these protocols not only prioritize your own health, but also of those around you. As to what tests you should do, I would recommend you first do an antigen test. You can even pick up one of those do-at-home antigen test kits. If positive, then you know what precautions you should take. If negative and you are showing symptoms, do the RT-PCR test. Obviously, do this working closely with your consulting doctor. Both the antigen and RT-PCR tests are painless and involve obtaining a sample from your nostrils and throat using a cotton swab. I'm leaving a link to this criteria down in the description box for you to download for your convenience. I hope this was helpful. Like, subscribe, blooping up some more videos here for you to watch. Signing out, Dr. Rohan Fonseca.